Good morning and welcome to the Angel Beat community. I'm happy to be here and honored once again to talk to you about healthcare and security. And so specifically, we are going to spend the next about 15-20 minutes, as I said, to talk about SaaS applications, about security and threat, and how it's affected healthcare, not only in this past year, but just overall the global landscape and where we are headed based on why healthcare is being targeted and specific reasons why it is lucrative and why the stakes are high. And specifically, then we will delve into how a possible solution like Cisco Umbrella can help mitigate some of those concerns. So with that, as I begin, I would love all of you within your individual organizations to think about these set of questions. Is the use of SaaS applications prolific in your environment? Are you moving more and more to direct internet access instead of backhauling traffic, for example, through a data center? Are you considering software-defined wide area networks to enable DIA or direct internet access? Think about those things, and during this presentation, I will share with you what we're going to talk about. We're going to talk about this changing landscape, as I mentioned, and the need for security. We're going to talk about Cisco Umbrella and how it integrates multiple security services, DNS layer, firewall, secure web gateway, cloud access security broker, and how specific customers of ours in the healthcare industry are solving problems today. And I'll end with some resources for you to continue to learn more. So with that, let's take a look at the environment. And to me, this is interesting. Frankly, this is something that was actually taking place even prior to last year and the pandemic, which is the times were changing, right? A lot of things were changing from the standpoint of how we worked. And so for many years, the model around building the biggest security stack and focusing on the headquarters had already evolved. A single place for security in your network was no longer the case. But at the same time, with this Pareto principle, as you can see here, it got inverted, it got flipped, where you have a lot more internet traffic taking place versus internal traffic within your headquarters, even branch locations. In fact, you can make the argument, and this is very interesting to think about, is all of us being remote and working from different places or endpoints are branches of our own, or a branch for one. So an interesting way to think about that as well. With that, looking at that workforce, if we actually double clicked into this, looked at it a little bit deeper, we would find that not only do you have this branch of one concept taking place, but the amount of remote workers really increased a ton, right? They were finding different and creative ways to not only connect and get the access to the information they need, oftentimes without a VPN, but even beyond that, there were a lot of different endpoints that were making their way into the network. So we look at this from our perspective at Cisco through DNS servers and activity. So we actually did this last year where we were looking at distinct IP addresses, sorting them into remote and office groupings. And even though I don't have a chart here, you can imagine how you doubled here at the end of March of last year, which really put a lot of pressure on a lot of you. Specifically in healthcare, you're spinning up resources, you're spread thin already, but you have all these remote connections, which ultimately gave attackers a new playground to be able to attack from. And that was a problem. So let's take a look at that problem in the next set of slides here, where I'm going to talk about not only the traffic that we saw and how it increased, but the overall customer impact and the key threats specifically in healthcare that we observe for our own domain name system DNS activity. If we take a look at this, unfortunately for North America, we led the way in malicious query traffic during the pandemic. Even though this ebbs and flows, as you can see here, there was an acceleration from malicious attacks, and that's clear across the board. So let's take a look at that even deeper. The overall customer impact, what did that look like? Well, lo and behold, it's things that Ron just mentioned, right? It's ransomware, it's phishing, it's malvertising, crypto mining. All of these resources were now being leveraged and the attack vectors were being prevalent. And the percentage of organizations seeing that activity was huge. So you see names that you recognize, but you may see things that you don't quite know. Droppers being, secretly installed malicious programs on computers, RATs, which would be remote access Trojans, where they gain access to victims' computers or loaders, right? So if we break that down even further, we took a look at that threat traffic by vertical. And you can see how healthcare is near the top of the list here, unfortunately. So if we broke that down even further, what were those key threats and trends that we saw in healthcare? The healthcare industry saw more Trojans than any other sector, as well as a higher number of droppers. Droppers are downloadable, executable, malicious payloads, if you're not familiar. The ones that really were prevalent, Emotet, if you've heard about that, that has been an advanced Trojan. It's primarily spread through spam emails. That and its close cousin, I guess if you can call it that, TrickBot, which is long-lived botnet, were at the top of the list. And many of them were very prevalent in 2020. It may come as no surprise to you, but ransomware also made its presence known. And so specifically things like Ryu, which are crypto mining ransomware, to other ransomware activity that took place surrounding Emotet, these were very prevalent and very much at the forefront. So let's take a look at why healthcare is being targeted. Now, you don't need me to tell you this, but I will break it down a little bit further just based on our observations and what we saw in the industry.
Don't worry about that. Remember, just like people have different weight, what happened to this guy? Oh.
Everything okay?
Sorry about that, Rohit. Sorry about that.
No worries. I will continue. I thought there might be a question there. So I will break down the healthcare, why healthcare is being targeted. And there's really 4 different reasons. It's lucrative. Unfortunately, many of our systems are slow to update. The stakes are high and limited resources, you can see here. So in terms of lucrative, for the 9th consecutive year, healthcare is the industry that's been hit hardest by data breaches. Primarily, it's hackers, obtaining that PHI, that patient health information or personal information. Today, believe it or not, healthcare providers spend an average of $429 per lost or stolen record. That's about 3 times more per record than any other industry. So right then and there, if the money is there, attackers will find their way there, unfortunately. Beyond that, updated systems. The global internet of medical things, that market continues to grow, as you well know, 158 billion valuation by 2022. But unfortunately, healthcare still relies on a lot of legacy systems, right? More than half of the orgs that we at least research still run Windows 7 versus we're up on 10, I think now, from an OS standpoint. So outdated technology can open doors for hackers to exploit vulnerabilities. The stakes are high as a result of that. Electronic medical records, EMRs, that makes it a very fertile ground. And then ultimately, we are all strapped for time, talent, budget, right? That is across industries, not just unique to healthcare. You don't need me to tell you that, but with limited resources, that means that IT security budgets perhaps get cut or maybe remain level. What we found is around 3% since 2016, especially for small and medium businesses in terms of IT security budgets. And when you have limited budget, you have constraints, it makes it very difficult to be able to combat the attackers. So specifically around ransomware, what I thought was very interesting is patient records are the most expensive type of personal information traded on the dark web. Since 2016, it's actually more than 172 ransomware incidents have cost the US healthcare industry more than $157 million, believe it or not. So that is the reason, right? Electronic health records and that PII and that information that becomes a hot target for ransomware attacks. Let's switch. What can we talk about? What can we do about all this, right? The threats are real, but that is our new reality, right? We have applications that have moved to the cloud. Alongside that, it's going to be your data, infrastructure, user identities. I don't know about you, but I can get a lot of things done in my role as product management without ever accessing the network or the VPN through SaaS applications. So it's important to have that visibility. Why? Well, because the attackers are not sitting idly, right? They're going to attack and they're going to find the vectors that are most vulnerable. So as we transform our networks with, say, software-defined wide area networks, branch office transformations, and connect directly to the internet, add on top of that, you have a more mobile workforce, more work happening off the network, as I just pointed to, right? It's not going to just be not using the VPN, but often it's coffee shops and it's remote locations. We have the move to 5G, where you have more encrypted traffic as well taking place. This ultimately leads to gaps in visibility and protection for your users. Oftentimes, they're accessing applications where they don't necessarily know if it is secure or not. What are the access scopes associated with it? The best way I think about this, and I even explain it to our customers, is you think about that connectivity piece. Your users connecting to your network, and then kind of the far edge of once they're on the network, how do they connect to applications? As a CISO, as a security administrator, we have to think about solving those problems through multi-factor authentication and SAML, but then even beyond that, web application firewalls and how we protect our users to be able to access the right applications that we feel are not only sanctioned in our environment, but that are safe for them to go to and perhaps part of our corporate policy and what we actually guide them or maybe pay for from a licensing standpoint. So very complex, but things that we have to be aware of, and it starts with that visibility. It starts with knowing what's taking place. Unfortunately, you can no longer depend on that existing on-premise security stack, right? There's a lot of holes there. You need a new way to secure your branch edge and cloud edge. That's where activity is taking place. That is where we're seeing it. You see it in some of the data that we see here and the statistics that I'm pointing out to you. I'm not going to read all of them, but you can see all that direct internet access, WAN activity to branch office transformations. So ultimately, these are the evolutions that are taking place in front of us. Today's security is not effective in securing remote and branch offices and roaming users. You need that on and off network protection to get you to where the activity is taking place. So what is Cisco Umbrella, you may be thinking? I've alluded to it. Let's get into that now for the next few minutes. It is beyond domain name system technology. It's a variety of different things. So even though we'll focus on DNS layer security here because it's simple and easy to manage, easy to deploy, our entire portfolio includes all of these things that you see here. We have secure web gateway technology, which is really proxying of traffic, right? You can proxy traffic, you can make decisions around proxying a branch location versus headquarters, and ultimately the problems or the use cases that you solve are granular controls. I want to take my C-level team and allow them to download information from Box as a cloud storage provider, but not upload information to Box. That is a use case that many of our customers solve for. Beyond that, cloud deliver firewall and granular IP controls. I want to block traffic to an SMPT server, as an example. Cloud access security broker. Data loss prevention is key. We talked about PHI and PII. If I want to scan and monitor said environments like Workspace or my Slack environment and look for PII or PHI that's taking place there, to be able to remediate that, I need a cloud access security broker. And of course, I need interactive threat intel to bring it all together to be able to have that visibility. So enter domain name system technology. It's a great place to start. Why? It's ultimately the phone book to the internet. And perhaps you're familiar with this, but anytime we punch in a domain, google.com, cisco.com, it resolves to an internet protocol or IP address, right? So the entire network uses it across all ports and protocols. It is cost effective. It's also simple to deploy. In a matter of minutes, 15 minutes, within an hour, you can point your DNS or DHCP server to the Umbrella network and you're off and running. You have that visibility, you have out-of-the-box protection, and many researchers have come back and said, well, DNS layer is a very useful and relatively cost-effective solution that is very simple to deploy, and it provides that improved detection, response time, and visibility into all those threats. We protect against crypto mining, phishing, all the attacks that I was talking about earlier that are prevalent in the healthcare industry. So as we wrap up here, I wanted to just point out a couple different use cases of customers, our customers that are using this technology today and how it's been effective for them. First one, Frederick Health. You see that as a relatively mid-sized organization, 6,500 users. You can see their objective there. What I thought was interesting about this, and believe me, when I used to attend trade shows like RSA and others, people would come up to our booth and say this all the time. They say, Rohit, I deployed your technology, and what I'm seeing and noticing is a dramatic reduction in alerts from my systems, right? In this case, the gentleman here talks about the fact that by 50% or more, they saw that reduction once they implemented Umbrella. So those threats aren't getting any more. They are not getting through anymore. And that is because of deploying the DNS layer technology that you see here. Beyond that, another example I want to point to, is Boston Medical, right? You may be familiar with this technology and this company as well. And so what I thought was interesting here is that the impact that this had on their organization. They blocked more than 1 million threats per month, right? So not only do you have that reduction in alerts, but the blocking taking place, setting that and having to just move on and seeing those threats, which are very easily detectable and dissected in our security reports, our activity search, and getting that deeper network insight then allow them to expedite these incident responses, right? That is not something that's very trivial. When you have an incident response team, it takes a lot for them to be able to just put their arms around all the threats that are taking place and then how to actually remediate those. If you can expedite that and provide more productivity through tools like ours, you're winning. So with that, as I close here, I wanted to kind of just touch on the fact that we have this solution. I've touched on the fact that not only is it easy to deploy and simple to manage, but because it's delivered entirely in the cloud, API-based technology, there's no hardware to install or software to manual update. You have on-network protection, off-network protection. If you're one of the 180 million users of AnyConnect from Cisco, you simply enable the Umbrella roaming security module and you're protected, or your users are protected when they're off the VPN. If you're not using AnyConnect, we have a lightweight standalone agent that works with any VPN, and it's had more than 1 million deployments, and you're off and running and protecting your network that way. Beyond that, a ton of integrations, as you can see here, with our routers, Meraki technology, be it the firewall or the access points that many of our customers use, and you can leverage the technology in that way. So with that, my call to action to you would be go ahead and take a look, schedule a demo at that URL, sign up for a free trial, signup.umbrella.com, and take a look at this solution for your sake. Hopefully, out of this conversation, you not only understood a little bit more about how we see the world and the threats that are taking place in the healthcare industry, but how a possible solution like Cisco Umbrella can help aid you and enable you to be more productive and protect your environment. With that, I am happy to take any questions we have, and I thank you for the opportunity.